Okay, good morning, everyone.
Good
So,
morning, ma'am.
taking the class on that unit one, okay, that module one. So, last time, if you remember, we have discussed related to the hospital services. Yes or no? Do you still remember what is hospital services? Anyone? What do you mean by hospital services? Please answer, anyone. Okay, you might. Okay, okay. Actually, what are hospital services? Okay, so hospital services are all those services which is provided by all the different department in a hospital. Okay, starting from the medical services in which all the medical personals will come, then your supportive staff like the housekeeping department, the CSSD, central sterile supply department, then laboratory technician. So all these other departments in the hospitals, they work together in order to provide the hospital services. So in today's class, we'll be learning about the patient care services. Okay, so I'll be sharing my slides now. Okay, is it visible, the slides? Please answer, is it visible, the slides?
Yes, ma'am.
Okay, so
Yes,
today
ma'am.
we'll be discussing about the what do you mean by patient care services? Okay, so actually, where does this patient care services? Where did we receive this? We usually receive all the patient care services either in the hospital, or it can be in any community health center, or it can also be in the home setting. Okay, so there are various areas where we can provide the patient care. Not only like since now we are dealing with hospital service subject, so we'll be focusing mostly on the hospital sites. But usually, this patient care services, it can be provided anywhere. It can be either in the hospital or it can be in any community health center, for example, like a primary health center, or it can be in a home setting. Yeah. So first of all, before going to the topic, let us know what is a patient. Okay, so the word patient, it comes from the Latin word patiens, which originally mean the one who suffers. So a patient, it can be anyone, it can be from any age group. So whenever we term the word patient, it means anyone who needs our care. That means a patient is someone who is dependent on others in order to improve health. Please mute your microphone. So, a patient is most often ill or injured and in need of treatment by a physician, advanced practice registered nurse, or any other healthcare professionals. Okay, so once we term patient, that means he is someone, like I've said, who is very independent. Okay, sorry, very dependent on the either he's by his, that means he need care. Okay, so either it can be done in, if you talk in the hospital, it is usually done by the doctors, by the nurses, and many other healthcare professionals are involved in the caring of the patient. So when we term the word patient care services, what does it mean? So patient care services are all those activities that assist the patient in meeting their basic needs. Because what happened whenever a patient comes to the hospitals, why he came? Because he is sick and he is unable to take care of himself and he is unwell. So what do we do in the hospitals? We perform so many activities in order to help the patient improve his health. Starting from the physician, he will do the health checkup. Then the nurses will do all the daily care, checking the vital signs, then helping the patients with cleaning, then all those, and even the other physiotherapists will come and help with their exercise, with the mobility. So patient care services, so many activities will come, and all these activities, they are directed towards improving the patient's health. And the patient care services also, they are all those services which is rendered by the members of the healthcare professionals for the benefits of the patient. So whatever patient care activities we are doing, so mostly all those we are focusing in order to improve the quality of life of the patient, so that we will help the patient to recover at the earliest and send him back healthy. Okay. So if we see what are the significance of patient care services. So why do we need patient care services? So first of all, we need it first. Why? In order to improve the quality of life of the patient. Because whenever a patient comes to the hospital, he is sick. So, and he is not healthy. So when he comes to the hospital, we will try to help him recover his illness. We'll try him to help him to recover fast. And with that, we will also try him to improve his quality of life. Okay. So secondly is we need patient care services is to meet the various aspects of patient needs. So a patient's needs, it not only focus not only his physical needs, so various aspects he might, it even comes to the mentally, he might, okay, need emotional support. Then it comes to the psychological need. So whenever we term patient care services, we should focus on all aspects of the patient's care, not only the physical care, but it should also come psychologically also. We will help the patient by counseling, because especially if a patient is having disease, especially like chronic disease, suppose like cancer. So already the patient is having so much physically, he is having so much pain. And not only that, because of the cancer, he might also become very depressed because he know that he don't have much time. So what happens? So the patients will be falling into depression. So in order to cope up with that, so we have the counselors, the psychologists. So all these people will help to to help the patient to cope with his problem. So on this patient care services, we will focus on all so many different aspects. Then to provide individualized care to each patient, because each patient needs, it might be different. As each individual of us, we are also very unique. And the way we deal with the, even to each and every problem also, it is very different. Okay, to ensure the patient satisfactory services. So that's why whenever we give any care to any patient or hospitals, what is our main aim is to ensure that whatever care we are given, it is up to the standards. We have to maintain the quality in order to make sure that the patient satisfaction is improved or it is attained. Okay, to provide a very safe, timely, so whenever any activities it is done, it should be done in a timely basis, and there should not be any delay in any services, and it should be effective. Whatever care, be it a little, be it taking the blood pressure, be it taking the blood glucose level, so all those whatever we are doing to the patient, it should be effective, and also it should be appropriate care should be provided to the patient in a hospital. Then to promote a positive patient recovery experience, so whenever a patient comes out of the hospital, he should have a very positive, as like positive figure or positive feedback of the hospital. So our main aim is, or of the care, so our main aim in patient care services is to help him to have develop a very good, healthy or positive recovery experience. So these are the main significance of patient care services. So why do we need patient care services? It is mainly because of all these. Okay, and so many other points also is there. So if we come to the next, that is, what are the scopes of patient care services? So when we talk about the scope, that means suppose for the patient care, so in which specialities or which areas are involved in the care of the patient. Okay, so actually this mostly the patient care services, it is a collaborative care. Okay, so it is not only done only by the physician, or it cannot only be done by the nurses, or it can only be done only by the pharmacy. So for patient care services, so many different departments and different healthcare professionals as well as non-healthcare professionals are involved in providing this patient care services. So the medical professional staffs, they are like for the like the physician, your nurses, then we have the physiotherapists, the radiologists, anesthetists, laboratory technician, pharmacists, etc. Okay, so and so many other professional staffs are there who are directly dealing with the patient, directly or indirectly dealing with the patient's care services. Okay, so we'll be seeing few of the scopes. So first of all is the admitting. Okay, so first of all, what happened when as soon as a patient, or even if you also if you have gone to any hospital, first of all you will go in the admission department. So like what happened, like in the simple example is I can give is of the reception. So as soon as you go to any hospital, first thing what you'll go is you'll go to the reception area, and there you will get yourself registered. Even if it's only for outpatient basis also, you have to register yourself. Okay, so whenever we enter any hospital settings, so the first area of contact, it is a reception area. So from there, we'll be getting all the information related to the hospital, as well as we will register ourselves. Okay. So once we are registered, we can take up the services. Either it can be in the outpatient services, or if needed, the patient might be taken care of as an inpatient services. Okay. So, and sometimes this registration also, it can also, we can do the registration even in the emergency department, because some patient might come with a very immediate or even emergency problem, or a very immediate, or anything which needs immediate, immediate care. So for those type of patient, immediately the patient will be taken directly to the emergency department, and from there also we can register the patient. Okay, so the first scope of services where it started for the patient, where does it start? From the admission. Okay, the second is the outpatient care services. Okay, so I think many of you have experienced, even for yourself, you must have gone to the hospital, okay, where you will be taking the outpatient care services, in which you will go and visit a doctor, then you'll be doing some tests, after you'll go back home. Okay, then next is the inpatient care services. So whenever any patient comes with a very severe problems which needs further investigation or further treatment, we opt the patient to go for inpatient care services. So once we are inpatient care services means what? The patient will be admitted to the hospital, okay? And he will be taken off based on his problem. He will be given, who has scribbled, please don't scribble on the screen, okay? So he'll be giving the care. So the next comes the medical services. So what comes under the medical services? So this thing comes once the patient is admitted, okay? So once the patient will be admitted, or even before that, okay? So the patient will be given some specific rooms, and in that specific room, so many services will be, or activities will be provided, be it the physicians or any other healthcare professionals. So medical services means what? These are those services which are provided by the healthcare professionals. For example, cardiologists, it can be a dental technician, or it can be a pediatrician. Pediatrician mostly are those doctors which are treating the pediatric, that means the small, young adult, okay? Small children up to 18 years. Then we have the gynecologists, then we have the general medicine. So many medical services comes under the medical, so many professionals comes under the medical services. So just remember, medical services means are those services provided by the medical professionals or the healthcare professionals, okay? Then the next comes surgical. So surgical services means what? These are those services which provides operative or any other invasive procedure which needs surgery. So all those services also it is provided by the surgical services or the surgical department. Okay, and not only that, even after the patient is done with the procedure, he will also be taken care. Post-operative means it is a period after the patient's finish his operation, or after the operation. That period is called as the post-operative, means after the surgery. So even after that also, the patient is usually taken care of in the recovery unit. Okay, so recovery unit is somewhere where the patient is based on his condition, he will be kept there for 1 day or 2 days, and after that they will be shifting him to his own specific ward or units. Okay. Then we have the intensive care. Intensive care means these are those services which is provided in the ICU. I think everyone have heard of the word ICU, which is called intensive care. So from the word itself, intensive care, so it is that care which is given to those patients who needs continuous monitoring, or who are having a very critical conditions, okay, which needs mechanical support, or so many having or anyone having any adverse health conditions. So those type of care, it is provided in the intensive care unit. Okay. And the next we have the nursing. Okay. So the nursing services, it is starting. So these are those services which is all which is all dealing with the direct patient care. So be it from starting from checking the vital signs, maintaining the patient's documentation, then doing the bed making and collecting the samples of investigation further. So many nursing services comes. Okay, so nursing services are those services which is provided by the nurse. Okay, in order to help the patient. Then the next come the clinical laboratory services. So these are those which is provided by the laboratory technicians. Okay, so all the testing, then the different, even the blood bank also is there. Then all those different facilities which is usually done in order to help for the diagnosis of the patient, in order to know what type of condition the patient is suffering, or when the physician order any type of investigation. So all those investigation, it will be done blood. Okay, it can be anything, it will be done in the laboratory services. The next we have is the imaging services. When the word imaging comes, so all this, these are all those services which is usually provided, like in, for example, is the radiology, then we have the interventional radiology, then CT scan, MRI, mammography, okay? So ultrasound, so all these services, it is comes under the imaging services, okay? So all these also helps in the diagnosis of the patient's condition, in order to know what type of problem the patient is having. So in order to further deal with the condition, they are going to do the imaging study of the patient's body or any other body structure, okay? Then comes the emergency and the trauma. So emergency and the trauma services are usually this services are usually given to any type of patient coming to the emergency department. Okay, so every hospital, they usually have this emergency department. So here in an emergency department, so different types of patient will come having so many problems, and they will. So the main aim of emergency is to provide, as the word itself, emergency means what? We have to provide immediate care. So whoever comes here, we have to make sure when the patient comes, first of all, we have to assess his condition, and based on that, we will provide immediate care to the patient, okay? And if the patient is fine, then we will send him back home, or if he needs further treatment, then from the emergency department, the patients can be sent to the any units or any wards, okay, for further treatment, okay? So in emergency departments, so they treat minor to severe illness, okay? So even if you suppose if you come with fever also, they'll provide you treatment there. And if any further investigation is needed, again, they will be shifting you to the rooms or wards, okay? Then central sterile services and supply. So these are those mainly, this central supply department, they usually provide all the sterile equipments and anything which we need for the care of the patient. They will provide all this from the central sterile department, okay? Then the next we have the nutritional services or the dietitian. So each and every hospitals, they always have the dietitian. So the dietitians, he will be planning a menu for each and every patient based on the calories requirement, especially patient with diabetes mellitus, hypertension. For them, specific calories is required, okay, in order to maintain their health. So for that type of patient or any other patient who needs any dietary restrictions, so this dietitian, they will go to the patient and they will plan a menu according to the patient's health conditions, and they will then after that, based on that menu, then we'll be providing the diet for the patient, okay? So this nutritional services also, they always aim to provide a very high quality food to all the patients, okay? And to help the patients recover early. Then the next we have the pharmacy department. So the pharmacy department also, they are the one who will be providing all the drugs to all the different wards. They will be dispensing the drug, that means distributing the drugs. Will be processed, that means they will be involving, especially if nowadays everyone is, all the systems mostly in any institution, everything is computerized. Yes, so even for the even in our this one also, even in many hospitals now they are practicing, everything will be computerized. So everything from the nursing station only, they will be typing whatever drugs which is needed by the patient, it will be typed there, and from there it will be sent to the pharmacy. Okay, so after that they will according to the order, they will be preparing the medicine, and after that they will be sending the medicine to that specific ward for that specific patient. Okay, so the pharmacy department only, they will be doing all this dispensing and distributing of all the medicine to the different wards or units in a hospital. Okay, and the physical therapy. So the physical therapy also as a word itself. Okay, and in simple word, we can say it as a physiotherapist. Okay, so the physiotherapist, they will be helping the patients with mostly with all the mobility, especially for patients, especially a patient having fracture or patient having stroke. So because of their conditions, they might have some physical problem. So in order to cope up with those physical problem, movement, mobility, so the physical therapy people, they will be dealing with this thing. Then next we have the medical record department services. So the medical report departments, they will be keeping all the records of all the patient. Okay, so all this, why do we need to keep this record? Because all these patients record in the later, okay, we'll be using this for patient review to see how was the patient's condition before. Okay, excuse me once. Okay, sorry. Okay, so they will be maintaining all the patient's medical record for any further review. Okay. Then we have the daycare services. So in this daycare services, a patient won't be admitted, but he will be providing care only for a few hours. Okay. Suppose if a patient is due for surgery on the next day or on that same day itself. So before the surgery, he might be needing some care. So for that care, it will be done in the daycare services. And the next is the home care, which is directly provided at the patient's home. So any professional caregiver, he can go, especially, for example, a nurse. Okay, she can go to the patient's individual's home and she can provide the care in his home settings. Okay, so these are the various scopes of patient care services. Okay, so do you have any questions? Are you all clear? Hello?
Yes, ma'am.
Okay, so, and all these different units, like I have mentioned about CSSD, so it will be further explained in details by in the other units. Okay, you'll be having this in the other units. So this is the patient care services. Okay, so just remember patient care services, those services or activities which assist the patient in meeting all his basic needs. Okay, so be it basic needs, it comes, be the fooding, then so many things comes under the basic needs. Okay, and why do we need patient care? Mostly the first important thing you have to remember is to improve the quality of life of the patient. Okay, then after that all these things will come. Okay, positive patient recovery, then to meet the patient ensure that the patients receive satisfactory services. So all this, and these are the various scopes of patient care services. Okay. Okay, I hope everyone is clear. Hello?
Yes, ma'am.
Okay, so if you have any further questions, you please go through the notes I'll be sharing in the WhatsApp group, and you can ask me in the next class. Okay? Okay, you
Okay,
please
ma'am.
give
Thank
your
you, ma'am.
attendance in the group. Okay? You can give your attendance there. Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.
Where is your hotspot?